Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hello, everybody. This is Dr. Keith, and I'm here once again to give another podcast concerning type 2 diabetes. And I thank you for everyone that listens. Thank you for everyone that has provided a review or have subscribed to our YouTube channel. You can check us out on YouTube, and please subscribe to the channel. Also, if you subscribe to where you listen to podcasts, most people is either Spotify or Apple, but anywhere that you can pick up podcasts, you should be able to pick up us. And we would love it if you follow us, subscribe, so that you'll know when a new podcast, a new episode drops, you'll be alerted. And also, if you can leave a review or comment. Also, if you can email us, if there's something that you would like for us to cover, or you had some questions about something that we talked about in the previous podcast, feel free to email us, and also have the email in the show notes if you don't already have that. So we really appreciate all the support. We've gotten a lot of good feedback from people in the community, and I invite anybody to give us feedback. You don't have to live in the Durham or Triangle area in North Carolina. I like to see how far the farthest place someone is listening to podcasts from. So if you're listening to, especially outside of North Carolina, I would really love to get an email from you, just saying where you're from, and I'll highlight it probably in a future episode. So if you want to get your name heard on a future podcast, just email me the town and city or country even that you live in while you're listening to the podcast. So that would be interesting to see who is the person that's listening from the farthest distance from us in North Carolina. And just thank everybody for the support. Like I said, if you continue to spread the word about the podcast, I mean, if you have friends or family members that have type 2 diabetes, or are interested or work with type 2 diabetes, or taking care of someone with type 2 diabetes, or they just may be just interested in hearing the sound of my voice. So please invite them, spread the word about the podcast. I want to get this information in as many ears as possible. So this is the hope that I'm providing a valuable service. That's the goal of this podcast, to provide valuable information for type 2 diabetics, such as myself. Like I said previously, I am type 2 diabetic. Right now, I'm managing to alleviate it and keep it under control, working on the path probably in the next few months where I can have it repressed enough that I won't have to take any medications. And I know that's crazy, because I'm a pharmacist, and I want people not to take medications. Well, as I explained in some earlier podcasts, I'm just over the years have seen that being able to work your body is just a great instrument. Your body is built to handle a lot of things, and one of the things is that type 2 diabetes is an indication that something is amiss in your body, and it can be corrected with proper education and management. That the symptoms can be minimalized. Not saying you won't have type 2 diabetes, because if you stop doing these things, the type 2 diabetes will come back, and if you don't really watch it, it can get worse. But there are paths to alleviate the conditions and reverse it. And I've worked with several people that they got it reversed to the point where they didn't need medications, or they could cut back severely, where they might have been on 5 or 6 medications. Now they may be on one just as a maintenance medication. So again, I'd like to thank everyone for their support. As I'm recording this, we're into early fall, almost getting into cough and flu season, right on the edge of it. So I really would encourage everyone, whether you're a type 2 diabetic or not, please get caught up on your immunizations before we get in cough and cold season. It said, like, people that are type 2 diabetic, a lot of times that these conditions can be worse for us because we already have a lot of times inflammation present. So that can make a lot of the conditions worse for us than someone that doesn't have type 2 diabetes. So if you haven't gotten your flu shot, need to get your flu shot. Most, like I said, most insurances, Medicare, most places, Medicaid will pay for the flu shot, so zero cost. And even if you don't have that, especially the regular flu shot is not really that expensive. So it's about the cost of a evening out, maybe, for one person. Depends on where you live at. But it's so important for you to get that, because you don't want to get the flu. You already have type 2 diabetes, and you don't want to complicate with a flu or pneumonia or COVID, because it can make those conditions worse. I also encourage people, if you haven't, the new COVID vaccines are out. I know there's some issues with now that is no longer paid for by the government, that some people are having some issues with their insurance companies paying for it. But from what I understand, most private insurance companies still pay for it. Most Medicare, Medicaid pays for the vaccine. And then there's, if you look in your community, there's also like certain clinics and health departments that still may provide it if you don't have insurance, free or low cost as well. So check that out in your community. If you're someone that doesn't have insurance, or your insurance some reason doesn't cover the COVID vaccine, just check with your local health department. They may, if they're not doing it themselves, they may can point you to who is providing COVID vaccines at low or no cost. So, but please, and then also if you're over 60, the new RSV, I know it's been having trouble getting it in stock some places with the rollout, but if you just check with your local pharmacy, if they have that, or your doctor's office, if they have that available, I definitely will recommend you get that right now before, like I said, cough and cold season. Especially if you're over 60, if you have health conditions such as like type 2 diabetes, high blood pressure, heart disease, it can be worse, arthritis, anything that's inflammatory, it can be worse for you. So please, if you're over 60, the RSV vaccine, and so far I've seen that it's covered, or it's a low copay for most people. So if you have most major insurances, it should be covered, but you can check with your insurance before you even line up to make sure that it's covered, or if there's a copay, how much the copay is. But I definitely will recommend that you get that. If you haven't had a pneumonia vaccine, especially if you haven't had one in the last 5 years, I think that you definitely will need to have that, or if you never had that as well. Another medical condition that can be worse for us type 2 diabetic patients. So if you haven't had it in the last 5 years, or if you're not sure, just be on the safe side. I would get that as well. And then there's some new pneumonia vaccines that cover more strains than the previous ones. So I definitely would, if you haven't had it in the last few years, I definitely would try to get that as well right now before cough and cold season. And of course, like if you're over 50, the shingles vaccine is pretty readily available. Um, Again, something that can be worse with us type 2 diabetic patients. So the aim with that, you usually have to have it in two parts. You have the first shot, and then the second shot can be between 2 to 6 months after the first shot. So remember that is one that you have to get multiple shots for. So just bear that in mind when you do that. And like I said, most major insurances, Medicare, Medicaid, most of them cover it, or they is at low cost. And again, you want to check with your insurance company just beforehand, just to see if it's covered and what's the copay if it's not. Most places like with the shingles vaccines where you're at, most time is that you would usually have to go to health department or health clinic or pharmacy. A lot of private physician offices don't usually stock it because of some of the storage conditions that, even though this is less now than before when used to have to be kept frozen, but that's no longer the case. But anyway, usually I just find where we're at in North Carolina that usually is most prevalent in like health clinics, health departments, and pharmacy. So you want to make sure to get all that taken care of before cough and cold peaks out. So you want to get it not like now, preferably before December, before we start getting cough and cold. Got the holidays coming up. A lot of people are going to be traveling for Thanksgiving, so they're going to pick up bugs, traveling, especially by plane. And so it's going to be the rates are going to go up. What we usually see after when people come back from the holidays after Thanksgiving, something that, usually that's when we might see like our first big flurry of the flu. It depends on where you live at. COVID, that usually goes up during this time, and other communicable diseases may go up as well. So you want to make sure that you get these vaccines into your system so you can just build resistance to these bacteria and viruses and stuff before the peak of it. So you want to go ahead and get that done now. If you haven't had it done, thank you. Then most of the people that have already had it done, but if you haven't, I really strongly will encourage, it may be a good time to do it now with the holiday, because usually a lot of times the doctor's office may be a little less busier because a lot of people are leaving town and stuff like that. So it may be a little easier to get an appointment to be able to get caught up on the vaccines. Okay, so enough of that. What I wanted to also talk about just for a few minutes today, I got some good feedback previously about dealing with diabetes myths. And so I just wanted to take another opportunity and review for those again. I think it's a lot of good information, and also I just will add. Hopefully, I'll be able to add like a sound effect with different questions and answers. Okay. First thing I wanted to think is that some of these, like I said, we've gone over in the previous podcast, but I thought I'd go over it again, especially since we have some new listeners, and also it never hurts to go over it again. Okay. The first myth is that if someone says that, diabetes is not a serious disease, and my answer to that would be diabetes is deadly serious. The fact 2 out of 3 people with diabetes will die of a major cardiovascular related episodes. Like we talked about in the past, one of the things with diabetes is that it increases inflammation. It lives off of inflammation, thrives off of inflammation. And this inflammation gets into your organs, gets into your blood vessels, makes them more blocked, leads you to a better chance of getting suffering a heart attack or a stroke. So diabetes is really serious. We talked about it before. That's probably like the biggest thing, the cardiovascular related episodes. So that diabetes in itself may not be fatal, but it may lead to the conditions where you get a heart attack or a stroke that turns out to be fatal. So we need to take it seriously. Your biggest thing is to get your numbers under control. And okay. And then another thing is that if you're overweight, you'll automatically get type 2 diabetes. That's wrong. Even though obesity is correlated, it's not necessarily with diabetes, that many people that have diabetes are overweight or obese, but that's not necessarily the case. There's people that are overweight and they have no diabetes, they have no high blood pressure, they have no high cholesterol. And then there's people that are physically on the outside that are skinny, but they have type 2 diabetes, or they may be pre-diabetic. People may not think that because they're not overweight and they don't get their blood glucose levels checked. Usually they don't find out until, unfortunately, a medical condition takes place, like they may have a heart attack, or they may have a stroke, or they may have a loss of blurry vision or something like that takes place, and then they discover that they're type 2 diabetic. And also there are some people that are with this term skinny fat, where they may be skinny on the outside, but they have a lot of adipose tissue, fat tissue underneath their skin, surrounding their organs. They're just as much or more than someone that's obese. So while they physically may look, somewhat healthy, they're like, not overweight, but inside they're full of inflammation, full of fat tissue surrounding the organs, blocking the arteries. So they're at high risk for cardiovascular event, a heart attack or stroke. May already have, like I said, they may have type 2 diabetes, or they may be pre-diabetic, and they don't get like their blood sugar because they don't figure, well, I'm not fat, I'm not overweight, so I probably don't have diabetes, even though I'm frequently urinating, going to the bathroom. I have a lot of excessive amount of thirst. I do have some, blurry vision. I do have some pain in my extremities, like my feet and my hands, but I don't know what it is, because I'm not fat. That is why we just can't go on just appearance, whether someone is diabetic or not diabetic. So it would just let people know that you need to keep track. That's why it's the importance of having physical exams every year. Make sure that you are getting like a fasting glucose, no matter what your weight is, or your family history, because type 2 diabetes is very prevalent. It's estimated that we may have, like, anywhere, I've seen a variety of statistics, that anywhere between 30 to 90 million people may be like in some kind of form of diabetes and not know it, because it hasn't tipped over, or the conditions haven't gotten severe enough where they would seek medical attention, or they don't vaguely visit the doctor, have physical exams and stuff like that. That's true. That's 90 million. That's almost a third of the country that may have diabetes and don't know it. And then on top of the people that do have diabetes, is that it's estimated that what it's like maybe 1 in 4, 1 in 5 adults now may have diabetes. And then you got another third that may have it and don't know it. So just the importance of just if you notice like if you notice like these symptoms, and then a lot of times that these symptoms are so subtle, and that usually diabetes is a gradual thing. You don't just pop up and have diabetes one day. Just over time, your body becomes more resistant to the insulin, and it doesn't work as well, and the blood sugar levels climb slowly but steadily in your bloodstream, until usually maybe you have some event, or maybe you do have some symptoms, and you do check your blood sugars, and then you see that they're elevated. Usually, if you start seeing some symptoms and you start measuring like your blood glucose, that's why you don't have to wait or need to wait before you're diagnosed as diabetic or pre-diabetes before you get in a blood glucose monitor. Now that the monitors are very relatively inexpensive, and the cost of the strips have gone down, and those strips and the lesser ones, they're pretty decent quality. They may not be as accurate as some of the higher end ones, but they're pretty decent. They give you a good range. So what you really look at is the range. If the range is elevated, or low, or whatever, you want to look at like trends or the range that will tell you more, and make sure to record your results so that you can show your provider next time that you have a visit, and they can evaluate and do further testing and see if you're someone that's maybe a type 2 diabetic. Let's see. I got another question I think we've gone over before. Okay, exercising when you have diabetes, it will increase your chances of experiencing low blood sugar. That's wrong again. You want to like exercise. Matter of fact, one of the best things to keep like your blood sugar under control is exercising. Now you have to bear in mind, like especially if you're taking like insulin product, if you have to supplement with insulin, now you need to bear that in mind when you are exercising. Like you may want to make sure that your insulin dose is not close together to your workout, because you may experience like low blood sugar. But usually that's might be the only people that might be the case for. Like if you're someone that's on insulin, and you may experience like low blood sugar, like if you exercise too close to the dose, then that's more with the short acting insulins, the Humalogs, not so much as like the long acting, like the Lantus products and Novolog. Those products tend to be longer acting, so they have like less of a of effect short term than the short acting insulin product. So you might want to bear that in mind. Like there's like things that I'm reading now is saying that even having a 5 or 10 minute walk after you eat can help stabilize and help keep the spikes, blood glucose spikes down. So it's a good idea, like after you eat, especially like if you eat a big meal, big lunch, big dinner, if you could walk, just like for 5 or 10 minutes, then your blood glucose won't spike, because it's going to go up anyway after you eat. And then if you're type 2 diabetes and your body is
working and struggling to keep your blood sugar in line normally. And then, of course, if you eat, then it can spike up to like a really high level or a dangerously high level. So you want to just make sure that you do like physical activity. That's actually one of the best ways to keep your blood sugar more stable, because it causes your body to convert that sugar into energy, because your cells need that to be able to provide the energy that you need to complete your exercise. And like I said, you don't have to go and run a marathon or run 10 miles. You don't have to do anything like that. Walking. They're finding that people get more benefit actually walking. A brisk walk is more beneficial than running 10 miles or running 5 miles. And that's hard to do, and that doesn't take the same toll on your body as running. I don't really run that much now. I used to run some, but part of the reason why I've had it cut back because of the toll it took on my knees, and that's one of the things that just going to like doing more, just walking, so it doesn't have the same wear and tear that running did. But definitely get outside, move your body. Don't let the weather keep you, because there's plenty of trails. There are indoor tracks, even if you don't want to be outside in the cold, that's available. Some people have workout equipment in their house that's gathering dust. There's time to dust those off and get them moving. I mean, that's really like one of the best things. If you want to control and get your blood sugar down, putting movement into your body. And like I said, it doesn't have to be extended. And 30 minutes is enough. Like most people, like 5 or 6 days a week. That's for most people, that's plenty. Yeah. That's something that, I'm trying to incorporate more when we have about 50 days left in the year. I just want to get started on to continue on into 2024. If you follow me at Hersey Pharmacy on social media, I'm trying to do that more and document that more. So just give me a shout, see if I'm doing what I say. If I'm not, just send me a shout on the social media. Said, I don't never see you doing any exercise or whatever. You're telling us on the podcast, dude, but I don't never see you doing that. Okay, so I'm gonna start trying to document it now, so that people can't say that I am, practicing what I'm preaching here. So I just want you to be well. I want you to be your best self going into 2024. Wouldn't it be just great if you 2024 that you could give yourself the gift of like good health, that your diabetes is under control, you're not adding medication, you might be even subtracting medication, you're not paying the big co-pays for insulin and the weight loss products, like the Wegovy and Mounjaro and Ozempic. Because even if it's covered by insurance, a lot of times the co-pays are a lot more than the generic drugs, that you don't have to be on those and strain or use up your prescription benefits through the year. If you're someone that has a plan that maxes out, or if you have someone that has a plan that has a high deductible, that you have to pay a high deductible because of these products are very expensive. Just think about that. Think about that. So I mean, that's use this. I know it's very difficult now with the holidays coming up, all the temptation. I think to it too. So, I try to plan the strategy, not saying that I don't eat the stuff, but just try to eat a lot less of it. And then, like I said, then try to move afterwards if it's possible, like after eating, like even if you walk around the house, for 5 or 10 minutes afterwards, try to minimize the effect on your blood glucose. Try to eat less than what you usually do. Try to incorporate, even if you eat for Thanksgiving and Christmas, try to incorporate more vegetables and eat the vegetables first before you eat the proteins and the starches and stuff. Try to eat the starches last to try to minimize the effect on your blood glucose. And I think these are good tips. And like I said, I am in the process of finishing an ebook that has some information about this, some tips on keeping a stable blood sugar. Is aimed at health professionals, but anybody can use it. I know that health professionals, we put everybody first and not our own health. We're so busy taking care of others and doing for other people, we neglect our own health and may have developed like type 2 diabetes. And then we may be a little embarrassed or ashamed that we have it because we feel like that we're highly educated, we're health professionals, we should know better. I don't know how I got this. It's just a failure. And no, it's not. It's not a failure. It's very difficult in this society, especially if you're in a high stressful job, and we have the food choices that we have here. A lot of it is so bad for us. It's very, very easy to get addicted to these terrible foods that do nothing but drive inflammation in our bodies, and then puts us in all these disease states like diabetes, like high blood pressure, like high cholesterol, like arthritis. All these stem from inflammation and poor diet. So don't beat yourself over that. I'm in the process of starting a one-on-one coaching program where I can work with you, and work with you, privately. Not doesn't have to get a attraction. And I understand that a lot of times people may be a little embarrassed or ashamed of having this medical condition. Well, that's okay. You got someone. I'm right here. I've been right there where you are. I'm a type 2 diabetic myself. And it was the years that I was in denial about my health condition, that I didn't take care of it because I was in denial that I should have. And of course, if you don't, the condition gets worse. And now I'm trying to work on reversing that. And I would like to work with you or anyone else that's willing to work. I'm someone that can guide you through this, and where we can get it under control, and we can even reverse some of these conditions over a period of time. I would love to work with you, and like I said, I'm be putting out soon a coaching program where you can work with me one-on-one. And it doesn't matter where you're at because we can do it virtually. So it doesn't matter. We're not limited by geography. Don't have to be in the Triangle area or even in North Carolina. You can be in another state or even in another country. I just don't I want 2024 to be the best for you. I'm willing, and if you're willing to put in the work, and it's not a whole lot of work. It's not like you have to go on something drastic, a drastic diet or a drastic exercise program that's hard to maintain. It's just making tweaks in our daily lives, and building that up over time, over a period of time. You'll be amazed what can happen with your body. And then, of course, your mind will be easier because you won't have the stress of having this chronic disease or other chronic diseases. You'll feel better. You'll have more energy. And I said, I would love to work with you. I'm going to have an ebook out very soon. It may be out by the time that this episode publishes. I don't know. If not, it'll be at the one after that. I have some good guests lined up in December. It gives some good information going into the end of the year, the start of the new year. So stay tuned for that. And again, I just appreciate everyone listening. I just appreciate all the support. If you're like a health professional, busy health professional, you don't have to be ashamed anymore. Work with me. I work with you. We can do it together. we can help get this under control so that you can be the best person for your patients, for your family, just in your life in general. So um, if you know someone like that, even if that's not you, but if you know someone that's like that in that has type 2 diabetes, may not be under control, maybe suffering health conditions, um, please point them to me. I'll be glad to work with them. Um, Thank you again, um, everyone, for your support, and look forward to future episodes. We got a lot of good things coming up, and I just want you to continue to have um, hopefully a blessed holiday season, a healthy holiday season, and just continue to be well. Thank you.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.